Question, did the state have to adopt these CDC guidelines or was this a choice?
This was a choice with the governor, Department of Health, Department of Education. It was definitely a choice that we all sat around and discussed.
Okay, and then when were these guidelines that we're shifting from first implemented? How long have we been using those previous guidelines for? Do you know that?
So these current guidelines were just released last week. Prior to that, it's been over a year and a half, and that's why they were updated, because the current case-only based tier system was just outdated and didn't make sense anymore.
Thank you.
In this endemic strategy, maybe this is for the governor, do you foresee yourself or the state ever going backwards to requiring masks or imposing other restrictions, or is that for sure the thing of the past, even if there is another variant surge?
So it's going to depend on the circumstances, Brian. So we'll follow the science, we'll follow the guidance as we have been, and we'll continue to do that. Today, we feel as though that the measures that we have taken over the last couple weeks have been justified, and now they're being recommended by the CDC. So, of course, if we need to go back to an area where we got to keep people healthy, we will. But at the same point in time, we don't want to be doing things restrictive-wise that we don't necessarily have to do. So we'll take it based on the circumstances that we're currently dealing with on a daily basis.
The health department, I think, is considering new regulations for healthcare workers to drop the vaccination mandate in certain situations, from what I understand. Can you explain this strategy and what you say to the healthcare workers who lost their jobs over the mandate?
Well, first I would say that, as Dr. Chan said, where we were last year and where we are this year is two different worlds. Where we were in September of 2021 is different than we are right now. So the measures that we're putting in at any given moment of time are based on the facts, they're based on the data, they're done in a way to keep people safe, and we'll respond going forward on that. There is a review of regulation right now talking about really developing the idea that boosters are important, but there is a recommendation by Dr. McDonald right now, because of where we are, that masking also could be an option. That's open for discussion right now. That is not a regulation that's in place. You're going through your regulatory process of review, which public comment is going to be welcomed.
Commissioner Novese, if you would, can you expand on the child care guidelines that are being introduced here?
Good morning, everyone. It's an easy way to approach that supports both the staff and the families, as was discussed by the governor. But basically what we are proposing is we have it monitor to stay and test to stay, two different approaches. On the monitor to stay, what we do in case of exposure in the daycare, it's recommending that if we are in a low transmission phase, which we are, it's recommendations, not requirements, that that the children and the staff that otherwise would need to quarantine, that they can stay attending the daycare as long as they test, they screen for symptoms for 5 days post-exposure, and then on day 5, they test. So that's the requirement, and they use a mask during that time. If you are in a period of high transmission, the change is that you continue, instead of just monitoring for symptoms, you test on a daily basis before going to the daycare.
And a high level, low level, do you break this down by county, or do you take the state as a whole?
We have it both right now. Rhode Island is at state, and all counties are at the low community level. And these are recommendations that we are putting forward and not requirements. It's a way of supporting families and daycares and staff to stay engaged, families to stay engaged, kids to stay attending in the phase that we are right now.
I have two questions. The first is for you, Dr. Chan. If the community risk levels going by county, would Kent and Providence County always be higher in theory since the major hospitals are there?
So it's based on where people live. So depending, small state, a lot of people get routed to some of the central systems. So it should not be based on the hospital systems and where those are admitted. So good question. And by the way, we're at low. And so remember, with Omicron, it's been less severe. So even if we see case counts rise, if we don't see hospitalizations rise, then we should still theoretically be at low levels. So that's why this new system makes sense.
And Governor McKee, I want to talk about the military medical team. They're leaving this weekend. Can you talk about the impact that they had on the hospitals and the National Guard help?
The FEMA?
Correct.
Yeah. Yeah, so we're very thankful for the response that we received from FEMA at the highest level, the national level, and we thank our emergency management with Mark Pappas for making sure that that happened. We were one of the few states who were able to get that help, and I know that when I toured there and welcomed the FEMA staff from all over the country, by the way, and thanked them for that. It was very, it reminded me of what happened at the Dunk when we had FEMA doing the shots as we were really accelerating the shots. So yes, very, very important. As far as the National Guard goes, I don't think you have to, I don't think you have to say it over and over again, but I think you do have to continue to thank the National Guard for their response with the General Callahan and that entire management team. They stand ready, continually stand ready, and we're very fortunate to have which is one of the best, if not the best, National Guards in the country, and their response has been, beyond explanation, to tell you the truth, in terms of that response. So yes, so both the National Guard and FEMA have been extremely helpful, and as I said in my comments, I know we're happy the fact that we've extended, as we did. Remember, when we were coming up in the fall, the date of FEMA's reimbursement was going to end on the 31st. So we were certainly, making arrangements for that to happen. When it got extended to March 31st, we responded to that as well. We're doing the same thing right now, having it extended to the end of June. That gives us a great more flexibility, and we're going to take advantage of it. Thanks.
Governor, since you took office a year ago, we've had COVID briefings pretty much weekly, sometimes more frequently, sometimes a little less frequently. You giving any thought to the schedule going forward as we enter this endemic stage? How many briefings will there be per what period of time?
Yeah, so I think that right now we're planning on staying weekly as long as we have work to do, and we do have work to do on the boosters. We want to use this forum. I thank you for being here over this period of time to communicate with the people in the state of Rhode Island what our task at hand is in that current moment. So we're going to continue to do that. The Lieutenant Governor and I will be getting back to our weekly, a bi-weekly event now that we're moving into this stage. We've been focusing on obviously on the COVID and the Omicron, but now we'll make the adjustments. But I think it's important for us to continue to communicate with the people of the state of Rhode Island. So we're going to try to continue that, and hopefully you keep on showing up to let people know what is happening on the ground. And the work is not done, but we are very fortunate, as Dr. Chan said, to be in the spot that we're in right now.
And Commissioner Infante-Green, if I could have a moment of your time. With COVID mitigation, if you will, writ large, being largely accorded to the individual school districts now, there's obviously a number of different approaches being taken, predominantly in the urban core. They're still requiring masks as you get into the suburbs. Most of them are leaving it optional. And then, of course, there's Barrington, which is in the process of constructing its own CDC at this point. Should the decision be subjected, if you will, from a legal basis or even a moral basis to the school board and required to be a vote, or in your interpretation of Rhode Island law, are they able to just hand down these edicts without any sort of vote or any sort of, input from the citizens?
Well, the districts make those decisions locally in conjunction with their school boards and the superintendents. That's how they're doing it. And most of the districts are making it optional. So that's a decision that they make at the local level.
Who's going to be in charge of getting the community members number, or it's going to be a diversity? Because you leave it to the advertising agency, they choose whatever they want, and we want a lot of community members. to do the message.
Yeah, that's why I was asking anyone that had some interest, that felt as though that they knew somebody that could be a great spokesperson to get this, to make sure the boosters are out there. I think that the Providence schools have done a fantastic job. Well over 300 students got vaccinated last week alone, which is a good number, as we keep on moving forward. So we just invite people. I tell you, I was at the, talked to a couple of people when we opened up in Oneyville, right, the health clinic the other day, and there was some people that spoke at that microphone that haven't had the voice on this issue that we're contacting now to have this voice. Very important question. Thank you for asking that, because we need community, new faces to deliver messages. The general public, has confidence in individuals that live right in their communities. This is a still important message about the booster shots. This is part of the prevention we talk. Preventable, Dr. McDonald, Dr. Chan, preventable and treatable. And we want to make sure that we take advantage of the progress that is made. The only way we're going to do that is really penetrate into all the communities in the state, and in particular, as I said, the communities that have been lagging on the vaccination and on the boosters. There's no reason to do, we need to make sure we deliver the message in the language that they understand, that they have comprehension in a way that gives them the confidence that we all know, and you're hearing from Dr. Chan, Dr. McDonald, Dr. Alexander Scott prior to that, about the fact that these are safe measures, preventable measures. That's the message that we need to continue to deliver. And we're open to anybody that's out there that would make some suggestions on who that might be in that particular community. So I don't have a telephone number here, but we'll post a telephone number that they can call. They certainly can call our constituent service office, all right, and let it be known that they feel as though this is a way to really, and I'm talking about 50 people, 100 people, 1,000 people. There's no small group that's not important right now, and if we can figure out a way to communicate in there, we do have the resources to communicate, and we are starting to work with local media outlets as well as larger media outlets to make sure that this message gets out.